Why is it high again? I did everything right. If that sentence has ever crossed your mind before your first sip of coffee, then stop for a moment, because this is not random, and it is not rare. Every single morning, before breakfast, before the news, before you speak to anyone in your home, you reach for that device. You don't even think about it anymore. It's automatic. You prick your finger. You wait. You look at the number. And in that exact moment, something drops.
Not just the number on the screen, your energy, your confidence, your belief that what you're doing is working. You remember yesterday. You were careful. You skipped what you weren't supposed to eat. You made better choices than most people around you. And yet this morning, that number doesn't reflect any of it. So you sit there quietly, not angry, not even surprised anymore, just tired. If that moment feels familiar to you, then I need you to understand something very clearly. This is not a general health talk. This is not advice for someone casually browsing online. This is for people who live this every single day. My name is Dr. Daniel Reeves. I practice internal medicine and metabolic health at the Southwest Internal Medicine and Metabolic Clinic in Phoenix, Arizona. For over 20 years, I've worked with patients across the United States, many of them in their 60s, 70s, and beyond, who start their mornings exactly the way you just did. And I hear the same question over and over again. Doctor, why is it still high when I did everything right? That question matters, because behind it is something deeper than numbers. It's frustration, it's confusion, and for many people, it slowly turns into doubt about their body, about their effort, about whether anything is actually working. And here is what most people are never told. That number you're seeing in the morning is not simply a reflection of what you ate yesterday. In fact, in many cases, it has very little to do with it. Before we go any further, let me ask you to do one thing. If conversations like this make you stop and think about your health, about aging, about what's really happening inside your body, take a second to like this video and subscribe. This channel is not about quick fixes or empty promises. It's about giving you clear, honest explanations that most people are never told. Because what I'm about to share with you isn't theory. It's what I've seen in thousands of patients who believed they were doing everything right, and still woke up to numbers that didn't make sense. And more importantly, why that happens, and what you can actually do about it. Now, let's continue. And what I'm about to explain may completely change how you understand that number. Let's go straight to the question that's been sitting in your mind this entire time. Why is your blood sugar still high, even when you did everything right? Because you did think about it yesterday. You watched what you ate. You stayed away from the obvious triggers. Maybe you skipped the bread. Maybe you avoided dessert. Maybe you drank water instead of soda. You even moved your body, went for a walk, stayed active longer than you felt like. You made decisions that most people don't make. And yet, this morning, the number didn't move the way you expected. That disconnect, that gap between effort and outcome, is where frustration begins. So, let me say something clearly, and I want you to really hear this. The idea that eat wrong and your blood sugar goes up, eat right and it goes down, sounds simple. It sounds logical, but it is incomplete. And for many people, it is simply not how the body actually works, especially after the age of 60. Because that number you're seeing in the morning is not just about food. It is the result of a system that has been active all night long while you were asleep. Your body does not shut down when you go to bed. It shifts into a different mode. And during those hours, 3 very specific things are happening, whether you're aware of them or not. First, your liver is working continuously. One of its primary roles is to release stored glucose into your bloodstream to make sure your body has enough energy through the night. That process does not stop just because you didn't eat. Second, your hormones begin to shift as your body prepares to wake up. In the early morning hours, usually between 3 a.m. and 7 a.m., certain hormones rise naturally. These hormones signal your body to get ready for the day. But one of the side effects is that they also raise blood sugar. Third, your cells, throughout your muscles, your fat tissue, your organs, are either responding to insulin efficiently, or they are not. And that last part matters more than most people realize. Because insulin is what allows glucose to move out of your bloodstream and into your cells. If your cells don't respond properly, that glucose stays in your blood longer than it should. So when you wake up and check your number, what you are seeing is not a simple reflection of yesterday's discipline. You are seeing the combined result of everything your body did overnight. And that changes the entire conversation. Because now, instead of asking, "What did I do wrong yesterday?" you start asking a different, more useful question. What is happening inside my body while I'm asleep? And that is the question most people were never taught to ask. So let me give you the single sentence that reframes everything we've just talked about. You are not measuring yesterday's choices. You are measuring overnight biology. And once you understand that, something shifts. The frustration begins to ease, just a little. The self-blame starts to loosen its grip. But at the same time, a new question begins to form. If this is happening overnight, then what exactly is going wrong inside the system? And more importantly, can it be supported, adjusted, or improved? That's where we go next. So let's answer that question clearly. What exactly is happening inside your body? And I'm going to explain this in the simplest way possible. Because once you see it, everything else starts to make sense. Every time you eat, especially carbohydrates, your body breaks that food down into glucose. That glucose enters your bloodstream. Now your body has a decision to make. Because glucose in the blood is not the goal. It's just transportation. What your body actually wants is to move that glucose into your cells so it can be used as energy. And this is where insulin comes in. Insulin is a hormone released by your pancreas. But instead of thinking of it as something complex, think of it like this. Insulin is a key. Your cells are like rooms, and glucose is the fuel that needs to get inside those rooms. So insulin takes that key, goes to the door of each cell, and unlocks it. When everything is working the way it should, the door opens easily. Glucose moves out of your bloodstream and into your cells. Your blood sugar rises slightly after you eat, and then gradually comes back down. Smooth, controlled, efficient. That is a healthy system. But over time, especially as we age, something begins to change. The key is still there. The insulin is still being released, but the lock on the door doesn't respond the same way anymore. It becomes harder to open, slower to respond, less sensitive. So even though insulin is trying to do its job, the door doesn't fully open. And when that happens, glucose stays in the bloodstream longer than it should. Not because you ate too much, not because you made the wrong choice yesterday, but because the system that moves glucose out of your blood is no longer working efficiently. And this is the part that most people never hear explained clearly. The problem is not how much sugar you eat. It's how your body handles it. That one sentence changes everything. Because now we're not just talking about food. We're talking about function. We're talking about how your cells respond, how your hormones signal, how your system processes energy. And when that system starts to slow down or break down, the numbers you see, especially in the morning, begin to reflect that. Even if your behavior hasn't changed, even if your effort is still there. So when you look at that number again tomorrow morning, I don't want you to just see a result. I want you to see a process, a system that is either working with you or struggling in ways that are not always visible. And that brings us to the next critical piece of this puzzle. Because what I just described has a name. And understanding that name will explain why this keeps happening, even when you feel like you're doing everything right. That name is insulin resistance. And if you understand this one concept, you begin to understand almost everything about why your numbers behave the way they do. Insulin resistance means your cells are no longer responding properly to insulin's signal. The key is still there. The signal is still being sent. But the door doesn't open the way it used to. So your body tries to compensate. Your pancreas starts producing more insulin, pushing harder, sending stronger signals, trying to force those doors open. And for a while, it works. But over time, that system becomes strained. The pancreas can't keep up forever. The cells become even less responsive. and glucose begins to stay in the bloodstream longer and longer. That's the foundation. But here's where things become very specific to what you experience in the morning, because insulin resistance alone doesn't fully explain that early morning spike. There is another process layered on top of it, something that happens every single night, whether you realize it or not. It's called the dawn phenomenon. And despite the name, it's not rare. It's not unusual. In fact, it's extremely common, especially in people over 60. Here's what's happening. While you are asleep, your body is not inactive. It's preparing for the moment you wake up. Your brain, your hormones, your metabolism, all of them begin shifting in the early morning hours. Around 3 a.m. to 7 a.m., your body starts releasing hormones like cortisol and growth hormone. These are natural. They're supposed to happen. They help wake you up. They help mobilize energy. And part of that process involves your liver. Your liver receives the signal. Prepare energy for the day. So it begins releasing stored glucose into your bloodstream. In a healthy system, this is tightly controlled. The liver releases just enough. Insulin responds appropriately. Cells absorb the glucose. Balance is maintained. But when insulin resistance is present, that balance breaks. The liver doesn't just release a small amount. It releases more than your body can properly handle. At the same time, your cells are not responding efficiently to insulin. So the glucose being released has nowhere to go. It builds up, quietly, gradually, hour after hour. And this is the moment most people never see, because it happens while you're asleep. Which leads to the most important sentence in this entire explanation. By the time you wake up, your blood sugar has already been rising for hours. Not because of your dinner, not because of something you did wrong, but because of a process your body initiated on its own. That realization changes the emotional weight of that number, because now, instead of seeing failure, you begin to see physiology. Instead of blame, you begin to see mechanism, and for many people, that is the first moment things start to make sense. The frustration doesn't disappear completely, but it shifts, because now you're no longer fighting something you don't understand. You're starting to see how the system actually behaves, and once you see that clearly, the next question becomes unavoidable. If this is happening inside the body, what else is being affected at the same time? That question matters more than most people realize, because this is not just about glucose sitting in your bloodstream. This is about where that glucose goes and what it does while it's there. When blood sugar stays elevated over time, even slightly elevated, even inconsistently, it begins to affect one of the most important systems in your body, your blood vessels. More specifically, a very thin, very delicate layer inside them called the endothelium. Most people have never heard of it, but it is one of the most critical structures in your entire circulatory system. The endothelium lines every artery in your body. Think of it as a protective, active surface, not just a passive tube. It controls how blood flows. It regulates inflammation. It helps prevent plaque from forming along your artery walls. When it's healthy, your circulation is smooth, responsive, efficient. Your heart doesn't have to work as hard. Your organs receive what they need. But when blood sugar stays elevated over time, that lining begins to change. It becomes irritated. Inflammation starts to build. The surface becomes less flexible. Arteries that were once responsive begin to stiffen. Blood flow becomes less efficient. And this is where the consequences start to extend far beyond a number on a screen. Because your circulatory system touches everything, your heart relies on it. Your brain depends on it. Your kidneys filter through it. Your eyes are incredibly sensitive to it. So when that inner lining is damaged, every one of those systems begins to feel the impact. Not all at once, not overnight, but gradually, quietly. Until one day, it's no longer just about managing blood sugar. It becomes about managing complications. This is why doctors in the United States consistently emphasize that long-term elevated blood sugar is strongly associated with increased risk of cardiovascular disease, stroke, kidney dysfunction, and vision problems. Not as a scare tactic, but because the data is clear. And it all traces back to what is happening inside those blood vessels. So when you look at that number again, I don't want you to just think about glucose. I want you to think about circulation. I want you to think about the systems that depend on it. Because this is not just about blood sugar, this is about your entire circulatory system. And once you see that connection, something shifts again. Because now it's no longer just a question of, why is my number high? It becomes, what is my body being exposed to over time? And more importantly, what can I actually do to support these systems consistently, safely, and effectively? That's where we go next. So let's answer that question directly. What can you actually do to support these systems? Not in theory, not with complicated protocols, but in a way that connects directly to everything we just talked about. Because there is one piece of this puzzle most people completely overlook. And once you understand it, the strategy becomes much clearer. Your cell membranes, the outer layer of every single cell in your body, are made from the fats you eat, not metaphorically, literally. The structure, flexibility, and function of those membranes are built from dietary fat. And that matters because your insulin receptors, the very things that respond to insulin and allow glucose into your cells, are embedded in those membranes. So here's the connection. If your cell membranes are built from high-quality, stable fats, those insulin receptors function properly. They receive the signal, they open the door, glucose moves into the cell. But if those membranes are built from damaged, highly processed, inflammatory fats, those receptors don't work the same way. The signal weakens, the response slows down, the door doesn't open efficiently, and glucose stays in the bloodstream longer than it should. This is not abstract biology. This is happening right now at the level of every cell in your body. Which brings us to 3 specific oils, 3 natural sources of fat that have been studied for their potential to support these systems. Not as cures, not as replacements for medical care, but as tools. The first is extra virgin olive oil. This is one of the most studied dietary fats in the world, particularly in large US and European population studies like the Pre-Dimed trial, which showed significant cardiovascular benefits associated with regular olive oil consumption. Olive oil is rich in oleic acid, a monounsaturated fat that integrates into cell membranes and helps maintain their flexibility. It also contains polyphenols, powerful plant compounds that reduce inflammation and oxidative stress, both of which play a role in insulin resistance. When used consistently, olive oil supports better insulin signaling and helps stabilize blood sugar after meals. The second is black seed oil, extracted from Nigella sativa. This one is particularly interesting because it connects directly back to what we discussed earlier, the overnight process. Black seed oil contains a compound called thymoquinone, which research suggests may help regulate how the liver releases glucose during the night. In other words, it may help moderate that early morning spike by supporting the very system responsible for it. It also has antioxidant and anti-inflammatory properties that benefit both insulin sensitivity and vascular health. The third is flaxseed oil. This is rich in omega-3 fatty acids, particularly alpha-linolenic acid. Omega-3s are known to reduce systemic inflammation, support endothelial function, and improve the flexibility of blood vessels. And remember, healthier blood vessels mean better circulation and better delivery of glucose, insulin, and nutrients throughout the body. So these oils work through different mechanisms. One supports cell membranes. One influences overnight glucose regulation, one protects the vascular system, and together they address multiple parts of the same problem. But I want to be very clear about something. These are not treatments, they are not quick fixes, they are tools that support the systems inside your body. And when used consistently, alongside everything your doctor has already recommended, they can become part of a much more effective, long-term strategy. Because now you're not just reacting to a number, you're supporting the systems that create that number. And that changes the approach entirely. I want to leave you with something that comes from real experience. Not theory, not headlines, not trends. Over the past 2 decades, I have sat across from thousands of patients. Men and women in their 60s, 70s, even 80s. And I've seen the exact same moment play out again and again. They wake up, they check their number, and for a few seconds, everything goes quiet. Not because they don't understand the number, but because they think it means something about them. They think it means they failed. They think it means they didn't try hard enough. They think it means their body is working against them. And that belief, that quiet, internal conclusion, is often more damaging than the number itself. Because it leads to frustration, then discouragement, and eventually, for some people, it leads to giving up. But here's the truth. They were never failing. They were just missing the full picture. They were measuring something real, but interpreting it the wrong way. Because that number is not a judgment. It is not a verdict. It is not a reflection of your effort as a person. It is a signal from a system that is complex, adaptive, and still responding to everything happening inside your body, especially as you age. And once you begin to see it that way, everything starts to shift. You stop blaming yourself. You start asking better questions. You begin to understand patterns instead of reacting to isolated moments. So if you take nothing else from this conversation, take these 3 things with you. First, do not blame yourself for a number you don't fully understand. Second, take the time to understand what your body is actually doing, not just what you're being told to do. And third, support your system in ways that are consistent, sustainable, and grounded in how your body really works. Because real progress doesn't come from chasing numbers. It comes from supporting the systems that create them. And if this conversation helped you see things a little more clearly, then I want you to stay connected. Subscribe to the channel. Share this with someone who checks that number every morning and feels the same frustration you used to feel. Because the more people understand this, the less unnecessary fear and confusion we create around something that can be understood. And I'll leave you with this. That number on the screen is not judging you, it's guiding you if you know how to read it. If this story resonated with you, please like this video, subscribe, and share it with someone who might need to hear it. Leave a comment below. What has your body been trying to tell you lately? I'd love to read your thoughts. Because next time, I'll be sharing something most people never talk about. Cardiologist reveals the deadly 30-second morning mistake. Millions over 60 make every day. Thank you for watching. And remember, your best years aren't behind you.